beautiful audience. How are you guys doing this morning, Saturday? Well, it is morning my own side. I don't know what is the time in your area. All right. Good morning. How are you guys? Welcome to today's program. All right. I'm at least I'm about 5 minutes earlier. I'm supposed to start 7, so this is about 6:55. So I'm about 5 minutes early to the program. So I'm going to wait for that 5 minutes and then we start. You can message me directly. Once you're watching this program, you can leave a comment. You can ask your questions. And then also I'm streaming on Facebook and also on YouTube. This program is streaming now presently on YouTube and also on Facebook. So you can choose which stream to watch. You are welcome to today's program. Welcome, good morning or good afternoon or good evening, depending on your location. And once again, if my audio is not clear, please draw my attention in the comment section to adjust my audio. So once you can hear me, let me know in my comment section to adjust my audio. All right. So, I've published this topic since last week. We're going to be discussing about it. Okay. This is one topic that is, this is one condition or this is one illness that has been affecting men, particularly to be specific, and we have millions of men that are suffering from this condition. So we're going to shed more light on prostate. Okay, we're going to shed more light on prostate. So while I'm just waiting for 7 and then I start, so that everybody could be on board. Okay, what do you know about it? Enlarged prostate. Cynthia, you are welcome. I'm just waiting for the time. Because I started about 5 minutes early. So let me just exercise some patience so that at the exact time I will start. All right. I believe you guys please, if my audio is not clear, let me know on the comment section. If you can hear me properly, let me know properly. All right. Let's see what is going on here. You're welcome. You are welcome. All right, friends, you are welcome. Okay. We shall be discussing about enlarged prostate. What do you understand about what is enlarged prostate? What do you understand by BPH? Okay, what do you understand what is called BPH? Now, prostate is specifically for men. Enlarged prostate is a condition, it's a chronic condition, it's a serious condition that you must take seriously if you're a man. So we're going to be discussing about the causes, we're going to be discussing about the symptoms, and we're going to be discussing about how to diagnose it, when to diagnose it, and when to start monitoring yourself, at what age. Now, we're going to discuss about lifestyle changes, medication, surgery, if need be, complications, and then I'm going to give you guys my final thought. All right, enlarged prostate. What do you know about it? Now, enlarged prostate sometimes is known as BPH, which is benign prostatic hyperplasia. It's called BPH. Benign prostatic hyperplasia is called enlarged prostate. Now, enlarged prostate sometimes could be benign and sometimes could be malignant. If it is benign, it means it is not cancerous. That does not mean it cannot turn to cancer. If it is malignant, that means it's cancerous. Okay? Now, if you're a man, as you age, okay, as you age, if you're a man, as you age, your prostate gland can become enlarged. So, for instance, I'm going to discuss this program in a very simple term, without using too much medical chronologies not to confuse you. I'm going to give you guys a live, something that men can experience and start monitoring themselves. As you age, if you're a man, as you age, okay, your prostate gland can become enlarged. Can become what? Enlarged. Which is a condition known as BPH, benign prostatic hyperplasia. BPH is typically treated with lifestyle changes or medications. So when you have BPH, okay, it can be treated with your lifestyle changes or medications. Now, one thing you have to understand, if you're a man, as you age, what I said, you start getting your prostate gland becomes enlarged. Now, when you go to pee in the washroom and it takes you you spend about 5 minutes, from 3 minutes, because approximately for you to pee as a man doesn't take you less than a minute, or about a minute, or a minute and a half to get done and come out. But if you are standing there for 3 minutes, 5 minutes, struggling to pee, then something is wrong with your prostate. That's when you start becoming worried to see a doctor. When it takes you time to pee, and eventually when you pee, it's like there's still some urine left in you. You are not emptying your bladder. Then if you're a man, that should be a first sign that something is wrong with you. You have to see a doctor. So as you age, your prostatic gland becomes enlarged. And that's the condition we know as BPH, benign prostatic hyperplasia. Now, it can be treated with lifestyle changes or medications. Now, your prostate, when you have an enlarged prostate, does not mean automatically is prostate cancer. No. You can have enlarged prostate and it is benign. When it is benign, it means it is not cancerous. And that does not mean it cannot turn to cancer at a later stage if not treated. When it becomes malignant, it means it is cancerous. Okay? Now, the prostate is a small muscular gland in the male reproductive system. That's why I say this is specifically for men. You have to understand, okay, the causes, the symptoms, okay, and how to diagnose it. If you're a man, this is something you have to watch out for. Men suffers a lot of these prostatic issues. Now, it's a small muscular gland in a male reproductive organ. All right. I hope you guys are following. Okay, now, hold on, I'm going to get there. Now, your prostate surround your urethra. Okay, I'm just still on the intro before we start going into the nitty gritty of what is prostate, looking at the causes and how to treat it. Now, your prostate surrounds your urethra and makes most of the fluids in your semen. Okay, it makes most of your fluid in your semen. Now, the muscular action of the prostate helps, propel the fluid and then the semen through the penis during sexual climax. Anything that affects your prostate affects your sexual functions. Okay, there are two types. I'm not going to go into it now. Maybe in the later stage of the program, I'll expatiate more. Now, benign prostatic hyperplasia, which is the BPH, occurs when the cells of the prostate gland begin to multiply. When they begin to multiply, they become enlarged. And there's a centimeter that is going to enlarge that you need a surgery. And there are certain centimeter that it is, the doctors are going to look at other methods to see how they can treat it, either to give you medications to shrink the enlargement so that it's going to easy to pee. But there's a certain centimeter that is going to enlarge that demand surgery. Okay, so when those cells of the prostate glands begins to multiply, they inflate and becomes the enlargement. And when it becomes the enlargement, it puts pressure on your urethra. Okay, it makes it very difficult for you to pee. And even though when you pee, you don't empty your bladder. Okay, now these additional cells cause the prostate gland to swell. That's the enlargement. So when the cells of those glands continue to multiply, it makes those prostate gland to swell, which squeezes the urethra and limit the urine flow. The urethra is what allows the urine to go out. Okay, and other semens during sexual climax. So when that swelling occurs, it puts pressure on the urethra. Okay, it squeezes it. And once it squeezes it, it narrows the urethra to allow you free flow of the urine or any semen during sexual climax, and makes it very difficult for you to pee. And even eventually when you pee, you don't empty your bladder. Okay, now you have to understand where your urethra is located. Okay, your urethra, there's a straight line on top of your penile area if you're a man. Okay, that runs straight. That's what carries the urine to the penile area to get so that you pee and then push the urine out of your system. Okay, and also transport the semen during the sexual climax. So sometimes they're going to tell you, if you're applying any lotion or any medication, they're going to tell you be careful of your urethra so you don't cause more harms. Maybe you have an infection in your penile area and they give you a cream to apply. Okay, sometimes they're going to warn you, do not allow those creams to touch your urethra. You can apply it around it, but make sure it does not touch the urethra. Sometimes when you're using some delay creams, there are some men that ejaculate easily. As soon as they start their sexual climax, within a second they ejaculate. Sometimes they use a cream to delay that ejaculation so that they can enjoy the sexual activity for a longer period of time. So most of those gel or cream will warn you to avoid the urethra so that it does cause more harm than good. All right, so that's why I don't want to go into it maybe in the later stage. So we all know that when the cells of the prostate gland begins to multiply, because of those multiple cells that are multiplying, now it causes the prostate gland to swell and they squeeze the urethra and they limit the urinary flow. Okay, now BPH is the same as prostate cancer. Okay, and doesn't increase the risk of cancer. So when they say you have BPH, it's also the same as prostate cancer and doesn't increase the risk of cancer. So when they say they have BPH, yes, it's the same thing as cancer. So when they say you have, for instance, you went to the hospital and they check you your PSA, because when you are doing a PSA test, the test you are going to do to check your prostate is called PSA. Okay? Now, when the result comes back and say that you have an enlarged prostate, don't be scared, because you might be thinking that yes, it's prostate cancer. BPH is the same thing as prostate cancer. So when you have enlarged prostate, that is one aspect of that test. Okay, you have enlarged prostate. Now they're going to find out, the second thing they're going to find out is to see whether that prostate, the enlargement of the prostate, is it cancerous or not cancerous. So they're going to do biopsy. They're going to send it for a biopsy to find out if that enlargement of your prostate is what? Malignant or benign. So that's when they're going to send a biopsy, and they're going to take some tissues of those enlarged prostate and send it to biopsy. So when the result comes say you have BPH, enlarged prostate, do not panic. Yes, it's the same thing as prostate cancer, but at least you find out that you have an enlarged prostate. That is why you're not peeing enough, or that's why you have some symptoms. Now the next thing they do is to send it to a specialist. Okay? Or the family doctor will say, okay, you know what? I will send you for more in-depth investigation to find out if that enlarged prostate is benign or malignant. So it's the same thing as prostate cancer, but that does not mean it increases the risk of cancer. So when you have BPH, do not panic yet. That is one thing. You find out the cause of why you spend 5 minutes or 10 minutes in the and peeing, or why you don't pee enough. So when they say have a large prostate is one, okay, we'll find underlying cause why you are not peeing or why those symptoms are coming. You have enlarged prostate. Now the second issue is they're going to find out that enlarged prostate, is it cancerous or non-cancerous? That is benign or malignant. When it's benign, it's not cancerous. It's malignant, it means cancerous. So that's what they say is the same thing as prostate cancer. But as I said, do not panic yet. Until that enlargement is tested through biopsy. They're going to take a tissue of that prostate, enlarged prostate, to find out if it is benign or malignant. Or they'll send it for MRI test or CT scan, whichever the doctor chooses, to find out if that enlarged prostate is benign or malignant. So it's the same thing as prostate cancer, but that does not mean it increases the risk of prostate cancer. There's several processes to be done before they can conclude that, okay, your enlarged prostate is cancerous. So, however, it can cause symptoms that can affect your quality of life. We all know that. If you're a man, a lot of men that are suffering these things, when they have that enlarged prostate, it affects their quality of life. So what you need is that you have prompt diagnosis, and the treatment can prevent long-term complications. So once you know that you have a large prostate, treatment should commence immediately so that you avoid severe complications. Okay? Treatment should commence immediately. Once you've been diagnosed to have BPH, treatment should commence immediately to avoid prolonged complications. Okay? So that is the intro. So we're going to be looking at what causes benign prostatic hyperplasia. We're going to look at the causes now. Okay? All right, so let's look at what causes benign prostatic hyperplasia? What causes benign prostatic hyperplasia? Let's look at the cause. Now, when you have BPH, okay, BPH is common to men over the age of 50. Okay, if you're a man and you are over the age of 50, you should be concerned about prostate. That is where we find BPH. They are common in men over the age of 50, and also it is considered an unexpected condition of aging. Aging is one factor of BPH. Okay, aging is one factor of BPH, and that is why before you attain the age of 50, make sure you live an active life. Because when you live an active life constantly, you are mitigating against all these complications of BPH. Living a healthy, active life, exercising frequently, and living and eating healthy food will mitigate against this complication of BPH, even if you attain the age of 50 and above. That is why in your early age, tender ages, make sure you are exercising, make sure you involve yourself in physical activities, and also make sure you eat healthy. That's why they say lifestyle changes can also help you to avoid the complications of BPH. So we find BPH in men over the age of 50. And one condition that is expected, that is the cause, one of the cause of this BPH is aging. The more men age, they have a high risk of developing BPH. Now, although the exact cause is unknown, even if you attain the age of 50 or above, now changes in the male sex hormones accompanying aging may also be a factor. Okay, because the more you age, you become weaker to engage in sexual activities. So changes in your male, because the more you age, you might have less interest in sexual activities because you might not be that strong. Say for instance, you're in the age of 70s, 60s, 70s, you see your decrease in sex might reduce. So your changes in the male sexual hormones, okay, in addition to your aging, is a factor, okay, why you might have BPH over the age of 50. Okay, now, at what age, if you're a man, at what age should you start checking your prostate? If you're a male, when you attain the age of 40, if you're below 40, you don't have any problem. You don't need to be checking your prostate every time. But when you attain the age of 40, that is when you start checking your prostate, PSA, all the time. Maybe twice in a year. Some do it once in a year, but I recommend twice in a year. Every 6 months, do your PSA, check your prostate. So once you attain the age of 40, you have to constantly check your prostate to make sure it is in a healthy stage. The earlier you catch it, the better. The earlier you find out that you have an enlarged prostate, the better. Because that will give you have more chances of treating it, avoiding severe complications, and avoiding serious cancerous issues. And that is why, as a man, once you attain the age of 40, you start monitoring your prostate. You test your prostate, do your blood work twice a year. Others don't say once a year, but I recommend twice a year. Every 6 months, check your prostate. And the test, go to your doctor, say, doctor, please, I want to do my PSA. Once they do the PSA, he or she knows that you're referring to a prostate test. Then they're going to give you a lab worksheet to go and do your blood work and then wait for the result. Okay? So, at the age of 40 for a man, that is when you start checking your prostate. Okay? So, we're going to go to the next question. Okay? What are the symptoms of benign prostatic hyperplasia? So, what are the symptoms of BPH? So what are the symptoms of BPH, benign prostatic hyperplasia? What are the symptoms? Okay. Now, in my intro, I gave you guys one symptoms of BPH. Okay, Nalu, you're welcome. Okay. I don't know why my this thing, I have to see my notification is not hold on, I'm trying to fix my I'm trying to fix my notification here. Let me see. So what are the symptoms of benign prostatic hyperplasia, which is BPH? Now, the symptoms of BPH are often very mild. In most cases of, like say for instance, diabetics or even high blood pressure or cholesterol, the symptoms are very mild. You might have it for in your body, in your system for a longer period of time without even noticing that you have it because the symptoms are mild or silent. So most of the symptoms of BPH are what? Mild at the initial stage. As this condition progresses, the symptoms becomes active and noticeable, sometimes aggressive. So in the early stage of a BPH, the symptoms are mild, but they become more serious if there aren't any treated, if they are, that's to say, treated at the early stage. If there's no treatment, they become aggressive and even serious. They start noticing the symptoms. Now, what are those common symptoms of BPH? What are those common symptoms of what? BPH. I've said it before in my intro. I've given you guys one symptoms of incomplete bladder emptying. So you pee. When you pee, you could tell within yourself that you did not empty your bladder completely. There's still some urine left in you. So that is what we call incomplete bladder emptying. That is one symptom of BPH. Okay. The second one is called nocturia. Okay. Okay. Nocturia is when you pee more than once every night. So you have to wake up one more than once at night when you are sleeping to go and pee. Then that was called nocturia. Okay. So when you are going to pee more than one or more than two times at night when you are sleeping, then that is what we call nocturia. I've explained what is nocturia, which is excessive urination. When we are talking about symptoms of diabetics. Okay? So when you have excessive urination, we call it nocturia. That is the medical name for it. So if you have to wake up at night more than once, more than twice to go and pee, then that's one of the symptoms of BPH. Now, the third symptoms is dribbling. Dribbling, when we talk about dribbling, we're talking about, when you are urinating. When you are urinating, you finish urinating, and then you could see towards the end of your urinating, you could see the urine keep dripping. It's not, dripping little by little. It drip, it stop, it drip, it stop, it drip, it stop. You are standing there, okay, at the end, towards the end of your urine, you see dribbling, the urine is coming out small, it stop, it coming out small, it stop, coming out small. To empty your bladder, we call it dribbling. And that occurs at the end of your urination. All right? Now, the fourth one is inconsistence or leakage of urine. Okay? Inconsistent or leakage of urine is the fourth symptom. Okay? So when we talk about the inconsistency in your urine pattern, that means inconsistency is caused due to a weakened bladder. Okay? A weakened bladder muscles that damage the pelvic floor. Okay? So enlarged prostate, menopause, or even a bladder cancer can also cause you to have inconsistency, especially if the bladder muscles are weakened. So there's no straight pattern on your urination. So you have inconsistency. You urinate now, it takes you about 2-3 hours to go and pee. After that, again, urine, in less than 30 minutes, you're going back to urine. So there's an inconsistency. So your bladder is not able to hold the urine because of the weakened muscles. Due to either you are experiencing menopause, bladder cancer, all right, and also due to what is called a pelvic floor. When your pelvic floor is weak and the muscles are not strong, can also contribute to have an inconsistency in your urine. All right, so that is it. So inconsistency or leakage of urine is the fourth symptoms of BPH. Now we have something we call straining when urinating. Okay, straining when urinating is the fifth one. Okay, hold on, I'm going to post it. I'm seeing your question here, but I'm going to answer it, okay? So when I say straining when urinating, okay, I mean I'm trying to use a word, not to use a medical term. Hesitancy. Hesitancy, okay? And this is caused by also several factors. Prostate, enlarged prostate, either you have UTI, urinary tract infection, or you have a pelvic floor dysfunctions, neurological conditions. Now, in these pelvic floor dysfunctions, I'm going to make a video on pelvic floor. That is very critical for a man and for a woman, for you to have a strong muscles pelvic floor. If you have a weakened or dysfunctional pelvic floor, it's going to make it very, very hard for you to have a nice intimacy with your loved one. So pelvic floor function is very important in terms of sexual activities, either for a man or for a woman. So when you have straining when it means urinary hesitancy. Okay, straining, it means you are sitting down, you're having the urge to go and pee, but you are doubting, should I go and pee or not to go and pee? One man is telling you to go and pee, the other man is telling you to go and pee. So you are becoming hesitant either to go and pee or not to pee. But you can feel that you have the urge, you have the urge. The urine is there, but you are hesitancy to go and pee. Because you don't want to go and pee there, you're going to stand there 5-10 minutes trying to pee. So the hesitancy comes in, doubt comes in, and those will contribute to those symptoms of BPH. Okay? So now the sixth one is weak stream, urinary stream. So what do I say by weak urinary stream? You go as a man, as a human being, if you have to go and pee, if you're a man or a woman have to go and pee, it shouldn't take you a minute, about a minute and a half, or highest 2 minutes to finish your urine and come out. Anything that lasted more than 2 minutes, 3 minutes, 4 minutes, 5 minutes becomes a problem. So if you notice that you are spending 5 minutes, from 3 minutes to 5 minutes or more than that to pee, there's an issue. So that means you have a weak urinary stream. And when you eventually pee, the pee doesn't have a force. It is coming dribbling a little bit out. You are standing there, you could see the urine just rushing slowly. Those are weak urinary stream. Because when you pee, it's supposed to come with a full force. That shows that your prostate is healthy. But when you are urinating and it comes slowly, dribbling slowly, you can feel it slowly, it means there's a problem. Okay? That's when you start noticing there's a problem with your prostate. Okay? Now, the seventh one is a sudden urge to urinate. A sudden urge to urinate. That could be tied to nocturia when you have a frequent urination. Okay, now the eighth one is a slowed or delayed urinary stream. So you go to the washroom to pee. Okay, you go to the washroom to pee, and you are standing there. The pee has not even started coming. You are just standing there holding your penile. You are standing there holding your penile. You might be standing there for 2 minutes, not even started peeing. So that's what we call it delayed. or slowed stream. So when you are standing there, you have the urge to go and pee. Eventually, you want to go and pee, and when you are standing there, you're going to stand there for a minute, 2 minutes. The pee has not even started coming out, and eventually, when it starts coming out, it is slow. There's no force in it. Those are symptoms. Then we have the painful urination. Okay, painful urination is another symptoms, and then we have blood in the urine. This is how it progresses. So blood in the urine is the final situation. So it starts from incomplete bladder emptying, and it keeps progressing until you get to a stage whereby you are seeing blood in the urine. Painful urination. Now, one thing you have to understand, I've said to you guys in my other videos, all right? In no circumstances should you pee and see physical blood in your urine. When you see a blood in your urine, it is a serious problem, a serious problem that you have to see your doctor. When you are peeing, it means it has gone to an advanced stage. So when you are peeing and you see blood physically with your eye, that's a serious condition that you have to go and see your doctor. It means it has gone to an advanced stage. Now, there are certain urine that you cannot see. You are peeing, the urine is clear of blood. There's no blood in it. You can't see anything. But when it goes under microscope, they will see a trace of blood in the urine. So when they see a trace of blood in the urine, that's also a concern. They have to find out why there's a blood in the urine. There shouldn't be any sugar in your urine. There shouldn't be any glucose in your urine. There shouldn't be any protein found in your urine. And there shouldn't be any ketone found in your urine. And there shouldn't be any blood found in your urine. And when all these four things are found in your urine, they are all serious problems, indicating something that they have to be. You have to dig deep to find out why there's a trace of blood in your urine. Okay? So it's like something I said. Anytime you are passing a stool, there shouldn't be any. You finish passing a stool, you get it from the toilet, and you see a blood in your stool. There shouldn't be. If you see a blood in your stool, it's a cause for concern for you to see a doctor and do a colon cancer test. All right? So those are the symptoms as they progress. Do we have okay? Now there's somebody made a comment on YouTube. Let me see that comment on YouTube. Somebody made a comment. Cool Swag 4 says, I've had blood in my pee before it was visible, and it had filament. That's Cool Swag. He said, I have had blood in my pee before it was visible, and it had filaments. Now, I'm responding to Cool Swag. All right. If you have, as I said, let me repeat what I just said. There are two scenarios you can see blood in your urine. You can either see blood in your urine with a physical eye. When you are urinating, you can see your urine there's blood in it. When you see blood in your urine with a physical eye, it has gone to an advanced stage. You should take it seriously and see your doctor why there is blood in your urine. In no circumstance should there be any blood found in your urine, or protein, or even glucose, or even keystone. It means there's a leakage from somewhere that it's penetrating to your urine system. There shouldn't be in any circumstance should you find blood in your urine. There are blood you can see with the naked eye, And that means when you are peeing and you are seeing blood in your neck, it means it has gone to an advanced stage. There's something you have ignored for a longer period of time and it has progressed. Then you have to see a doctor immediately to make sure it is something treatable and not something serious. Now, there are urine you cannot see with your naked eye, except when, like for instance, when you go for a blood work, they give you a little container to go and pee in that container and drop it. There are some urine you cannot see with your naked eye. So anytime you pee, the urine is clear of any blood. You can't see with your naked eye, but when it goes under microscope, you'll see a trace or a blood in your urine. And you'll be wondering, when I pee, I don't see any blood. So there are two circumstances that you can see a blood, one under microscope and one with a physical eye. Now, if you find urine in your blood and you went to your doctor and they say it's a filament according to Kurzweil, filaments. All right? Not all blood found in the urine are cancerous or indicating tumor in your system, or there's something. So maybe there's a leakage somewhere in the blood vessels that allow, or in one of your nerves that allow blood to leak into the urine. For instance, if the production of your urine starts from kidney. To make a urine, the process starts from kidney. If there's an infection in those tracts, okay, if there's an infection in those tracts starting from the kidney to the emptying port, to the urethra, there's a tendency there will be a leakage from the blood vessels or from the nerves that allow blood to leak into the urine. But if they do further investigation, I don't know whether the doctor send you further investigation and find out maybe to a urologist. No matter when they find a urine in your blood, they will send it to a urologist to find out what are the causes, or why should there be any urine in your blood. Okay? So when they find this urine, we call it hematuria. Hematuria is when there's a blood in the urine. And then there are different causes. So you might be lucky that the blood found in urine is nothing to worry about. Don't say, tell you, don't worry about it. There is nothing. But as I said, when the blood can be seen with your naked eye, it's indicating a serious condition in your system that while you are peeing blood. Okay? This can include infections, kidney disease, or any rare blood disorder will cause. These are the possible causes of blood in the urine. So as I said, the blood may be visible or invisible with the naked eye. All right? But if you are lucky, it's a filament. There is not something to worry about. But if it's something to worry about, then doctor is going to tell you it's filament. But still, they'll send it to a urologist to continue monitoring you to make sure that it does not develop to something serious. So it's not something doctor is going to just say wipe away. Some doctors are going to send it to a urologist. They are the specialists to know what are those filaments, why there's blood in your urine. So even they tell you that don't worry about this filament, as a patient, you should worry, why is there blood in my urine? In no circumstances should there be any blood or protein or keystone or glucose in your urine. If glucose is found in your urine, it means you are diabetic or pre-diabetics. Okay, so if there's blood found in your urine, we call it hematuria. Okay, then something is wrong with your system. And the urologist is supposed to send you to a urologist to look further why there's a blood in your urine, whether it's filament or no filament. Okay, so and when you can see blood with your naked eye in your urine, 99% means 99.9% is going to be cancerous. If you are peeing blood in your urine and you can see it, 99.9% is cancerous. Okay, or a kidney disease. So whether it is filament or no filament, okay, make sure you see a specialist. All right. So before I go to the next question, I've just shared those that are watching me on Facebook. Let me see. Just hold on. Let me see. I don't know if I have to set up this one. Those that are watching me on Facebook, I have shared. I have shared to you guys the symptoms of BPH. Cool Swag, I'm going to answer your question about symptoms of bladder cancer. I'm going to answer your question about symptoms of bladder cancer. All right. He says, Cool Swag says, you have bladder cancer in your family, you want to know the symptoms. All right. Now, the symptoms of bladder cancer are similar to those of BPH. Okay? The symptoms of bladder cancer is similar to BPH, the benign prostatic hyperplasia. Now, the most common symptoms of bladder cancer, or whether you have BPH, is what is called blood in the urine. We call it hematuria. So when you have blood, they share the same symptoms. Either you have BPH, enlarged prostate, or bladder cancer. They have one thing in common. They have one symptom in common. We call it hematuria when you have blood in the urine. Okay? Now, other symptoms, now, apart from that hematuria, blood in the urine, which is the common symptoms of enlarged prostate, or BPH, or bladder cancer, is hematuria, that's the medical name, or we call it blood in the urine. Now, there are two stages of symptoms of bladder cancer. We have the early stage and we have the later stage. So you have two sets of symptoms for bladder cancer. We have the early stage and we have the later stage. Now, the early stage of bladder cancer symptoms is what we call the blood in the urine, hematuria. That falls under the early stage of bladder cancer symptoms when you start seeing blood in the urine. Now, this can be visible, as I said, or invisible with your naked eye. If you can see with your naked eye, it has gone to an advanced stage and critical 99.9%, it means it's cancerous. If you cannot see with the naked eye and it has to go under microscope for you to see it, then that is the early stage. Okay? I've seen some patients that have been seeing a trace in their blood in the urine for over 2 years. You keep monitoring them every year for over 2 years. When they go for a test, you see they say trace of blood in the urine. And then, because you have to keep monitoring them for years to make sure, I think it's after 4 years, they rule it out that it's not cancerous. They say they live your life, but they will keep monitoring you. Once they start traces of blood in your urine, you're going to be going to see that urologist once in a year. They keep monitoring you to make sure that it's not cancerous, because a trace of blood in your urine can be developed something that is cancerous. So when you are seeing a urologist and you have traces of blood in your urine, so every year you have to be going to see your specialist. I've seen some patients that have been for 2-3 years, they've been going for a test, and they see traces of blood in the urine, and they tell them, come back the next year. So for instance, if it's every February, it means every February of the year you have to go and see a urologist. And then they're going to go through that process again to make sure they check for any enlarged prostate or if there's anything serious. So after 4 years of critical testing, they'll tell you you're okay, because From the first day you started checking to the fourth year, if it is cancerous, it should have developed within that 4-year period. So after 4 years, and you keep seeing trace in the blood, and you've been seeing your urologist for 4 years, if there's no any cancer detected within that 4 years period, they'll let you go. Say, you know what, it is ruled out. Maybe it's one of those things your body is producing trace of blood in you, so nothing to worry about. For the first 4 years, if a cancer is going to develop due to trace in the blood in your urine, it should develop within first 4 years. If there's nothing within that first 4 years, your urologist is going to close your file and ask you to move on. Okay? So the first common symptoms of bladder cancer or BPH is hematuria, blood in the urine. And that falls in the early stage. As I said, there are early stage and there is the later stage. Now, the second symptom is frequent urination. Okay? Frequent urination, you are peeing consistently. Now, do not mistake frequent urination, because if you pee constantly, I think that you are diabetic. And then you want to do your blood glucose, they say, oh, your glucose is normal. But why am I urinating frequently? So you also have to check for a bladder, test for a bladder PSA, do a bladder test to make sure that it's not a bladder cancer, that is why you are peeing consistently. Okay, so frequent urination is the second symptom in the early stage. Now, the third symptom is what is called urgent urination. Okay, now remember, frequent urination is different from urgent urination. Frequency urination is that you are peeing consistently, maybe every minute or every 2 minutes. Now, when we have urgency in your urination, is different. It means an intense, sudden burst of urination. All of a sudden, you are not feeling it. All of a sudden, you sit down. All of a sudden, there's a burst, and you have to rush into the water because you're going to pee it in your pants. That is what is called urgency urination, because it's all of a sudden there's a burst. There's a feeling to urinate instantly without any sign. That is what we call urgent urination. That's the third symptom in the early stage. Now we have the painful urination, which is the fourth symptoms in the early stage. The painful urination. Okay, you find discomfort or burning sensation during urination. These are the early stage symptoms of bladder cancer. Then let's go to the later stage. Remember, when you see these early stage symptoms, try to find the underlying cause of those symptoms and get rid of it. Because when you ignore those symptoms and it progresses to the next stage, it becomes difficult. The more you wait, the more it keeps progressing, the more options to treat it narrows, and then you are putting your life at risk. But when you're able to catch the symptoms in the early stage, you have a lot of options to solve your problem and to avoid complications of that. But when you allow those symptoms to develop from mild to moderate, now to the aggressive symptoms, the advanced stage, by the time you get to the hospital, it's already too late. So that's why constantly you have to make sure that you catch them early. Okay? You have to make sure you catch them early. So let's look at the later stage symptoms of bladder cancer. Is difficult urinating. Okay? So you have difficulty in urinating. So you go to pee, you are standing there for 1 minute, 2 minutes, the pee is not coming. Okay? So you have trouble starting to pee. Or when you eventually start to pee, you find it very difficult to stop peeing. You know, it's either you find it very difficult to start peeing, you stand there for 2 minutes before, 3 minutes, 5 minutes before you even start peeing. And when you eventually pee, you also find it very difficult to stop the pee. So you keep peeing. Okay? Due to a weak stream. Because how you know a healthy prostate or a healthy bladder, as soon as you go into the washroom, it comes with full force. You could see the pee going straight. But when it is going slowly, you have a weak stream. That's a problem. Okay? Now you have, this is the later stage. Now we have back pain. Okay, back pain falls on the later stage. That are the symptoms of bladder cancer. Then we have pelvic pain. The back pain, don't mistake the back pain with the pelvic pain, because the back pain is different from the pelvic pain. So the back pain falls on the stagger pain, and then we have the pelvic pain. The pelvic pain is in the lower abdomen or the pelvis. You have your pelvic pain in the lower abdomen or your pelvis. Your back pain could be the lower back pain or could be the upper back pain. Okay? Usually on one side of your lower back pain. So when you have a back pain, it's usually on one side of the lower back pain. Then when you have the pelvic pain, it's in the lower abdomen or the pelvis. Okay? Now, the fifth one is loss of appetite and weight loss. Loss of appetite or weight loss. Okay? So, if you have, I don't want to explain that, you lost appetite, you don't want to eat, and then you start losing weight. And then the next one is fatigue will kick in. Fatigue, okay? Feeling tired and weak. And then the next one is bone pain or tenderness. Bone pain, your bones. You start feeling pains in your bones or tenderness. So if the cancer has spread to the bones, because if you don't treat it, cancer spread to the bones very faster. And when they spread to the bones, you start feeling pains in you. Even the slightest touch of your bone, you start feeling pain because the cancer has spread. Okay, and then you have the swelling of the feet. So these are the later stage symptoms. We have the early stage symptoms and we have the later stage symptoms. Cool swag, I believe I've answered your question. Okay, so let's go to continue what I'm discussing about BPH. Now, for those that are watching me on YouTube, I'm also on Facebook. The same page name. If you the same page name, you go on Facebook, you see the same page name. I'm also on Facebook, the same page name. You can find me on Facebook with the same page name where you can see all these symptoms listed. So if you go to my Facebook now, all these symptoms are listed as I'm discussing with you guys now. So you can also see the symptoms there and read about it in the comment sections. Okay. All right. So let's go to let me see what questions are coming in here. Okay, this one says, how is benign prostatic hyperplasia diagnosed? How is BPH diagnosed? How do you diagnose BPH? Okay. So first of all, your BPH diagnosis starts from your family doctor. Your diagnosis of BPH starts from your family doctor. So your family doctor will usually begin doing some physical exams on you and also asking you some medical history questions. So that family doctor will get some information from you and analyze it. Okay? Now the physical exams include a radical examinations that allow the doctor to estimate the size and shape of your prostate. Now this physical examination, okay, this physical examination is intrusive. Men that have gone through the process, as I said, when you attain the age of 40, if you're a man, that is when you start testing your prostate twice a year, every 6 months. Go to your family doctor, say, I want to do my PSA test. Okay, it's going to cost you some money, but at least it's worth it. You're trying to save your life. Now, the physical examination starts from your doctor or when you visit a urologist. It is too intrusive. So your doctor is going to determine the size of your prostate. How does your doctor determine the size of your prostate when you're in the doctor's office? So if you're a man, your doctor is going to ask you, take you to another room and ask you to bend down. You bend down, you push your ass back. Your doctor is going to ask you to hold the table. You hold the table. Okay, your doctor is going to ask you to hold the table, and then you bend down to push your ass out. And when you bend down, the doctor is going to wear a glove, and he's going to put two of his fingers in your anal. He's going to put two of his fingers in your anal because you're going to push your back out when you are bending down. You're going to pull your pan down, and then you're going to bend down and push your ass back very well. And then the doctor is going to put a glove and then insert his finger in your anal to check for the prostate. So if the prostate is enlarged, that doctor or the urologist will be able to tell the size of that prostate by inserting his finger in your anal to check for that prostate. And if he finds any enlargement, he can now send it to a urologist. And the same process is going to start again. The urologist is going to also insert their finger in your anal and then to see how big is the prostate, or through blood work or through MRI or CT scan. That is when you go to the urologist. But in your doctor's office, the physical exam is that you're going to bend down, pull your pan down, hold the table and push it in your ass back, and he's going to put a globe and put two of his fingers in your anal and then test the prostate to see how big. If he cannot feel the prostate, it means there's nothing to worry about. But if he can feel any enlargement of the prostate, by inserting the two of his fingers, he can touch it and be able to determine how big it is. So that's the physical exam that's going to start from your family doctor, the diagnosis. Then the other diagnosis is through urinalysis. Okay? They're going to do either through urinalysis, okay? Your urine is checked for blood and bacteria. Okay? So they can also collect your urine and check for blood and bacteria in your urine. And also, that's another one way of diagnosing BPH. The next one is urodynamic test. That's what we call urodynamic test. Your bladder is filled with a liquid via a catheter to measure your bladder pressure during urination. So what happened in this? Okay, this urodynamic test, they will fill your bladder, okay, with catheter, okay, to measure your bladder pressure. Okay, there are two ways. Either they fill the catheter to measure your bladder pressure, or normally that's the normal way they do it. So they fill your bladder the catheter to fill your bladder pressure. So they will, when they fill it, now they'll take you to a washroom. You are not going to pee in the toilet. No, the toilet is sealed off. They are going to ask you to pee in a container on the floor. Okay? They're going to ask you to pee on a container in the floor. Now, what happened is that when you are peeing in the container in the floor, that container is attached digitally to a computer. It measures the stretch, the pressure from your urine touching that container on the floor. That's how they determine if you have a weak or strong urination. So you are standing there, they say, pee on this container here. So when you are peeing, that container is connected to a computer, a digital. So when you are peeing, the pressure of your urine is measured. When you get in touch with that container, that's how they know how weak or forceful your urine is. So we call it urodynamic test to know how weak is your bladder or how strong your bladder. Okay, so that is another way of testing your bladder pressure. Now the next one is prostate specific antigen, which is the PSA. That is the normal way. The PSA test is what every man does. We call it prostate specific antigen. Okay, PSA. So you go, they collect your blood and they do a PSA test to find out if your prostate is enlarged or you have a normal prostate or you have a prostate issues. So they use the PSA test. That's what every man use. That's what I use all the time. Okay. Now the other one is post-void residual. Okay, this tests the amount of urine left in your bladder. The post-void residual. So after you finish peeing in that container will measure the pressure of the urine coming from your bladder to see how weak or strong it is. These are ways to analyze your prostate. Now, after you finish peeing, they'll take you back to your room, ask you to lie down. So we call it post-void residuals. So the doctor is going to come when he asks you to lie down and pull your pants down, just a little bit. Pull your pants down, and he's going to put what do they call it? I'm trying to remember the name. I have a lot of things in my brain. I've tried to. You know what? I'm going to give you an example. I know them, but it has escaped my memory. There's a name they call it. Why? Shame on me. Please forgive me. You know, when you go to those pregnant women, they want to see the baby in your stomach. They put an oil and then they try to move it around, and then they can see the baby on the TV screen. Okay, they see a baby on the TV screen by rubbing, moving around. I've forgotten that name. Oh, shame on me. Shame on me. Okay, so the post-void residual. So when you finish peeing, they ask you to go and lie down, wait for the doctor to come in. Now they're going to, when you're going to pull your pant down below your pelvis, a little bit below your pelvis, they're going to put that camera there, that device there, and check if you empty your bladder or if there's any urine left in the bladder. That is called post-void residuals. Sometimes you feel to urine, and when you go to urine, you can feel that there's some urine left in you. So that post-void residual is after you finish doing that test of peeing in that container. As you go back to your room, the doctor is going to come and then pull that device, move it around, and check your bladder to see if you empty your bladder or if there's urine left in the bladder. That is what's called post-void residuals. And then the last test is cytoscopy. Okay, cytoscopy is the examination of the urethra and the bladder with a tiny lighted scope that inserted into urethra. So they insert it into your penile area. They open your penile where you pee, and they insert a camera in it and check. So those are the ways to diagnose if you have BPH. All right, those are the ways to diagnose if you have BPH. All right, so Julie, you're welcome. How are you? Okay, we're about to round up. I think I have one more question. I have two more questions here, but do you guys have any question? Cool swag. Thank you. You're welcome. You are welcome. Now, I have two more questions here before we go to treatment. Okay, I have two more questions here, and then and those two questions are very important. This person is asking me, can you treat benign prostatic hyperplasia without medical intervention? So in excess, he's saying, can you treat BPH without any medical intervention? Okay, so now I wouldn't recommend you treating your BPH without medical intervention, because I will look at it, you are looking for a shortcut. That shortcut might be the cost of your life, because when we talk about BPH, we're talking about serious condition and need serious attention. So when you have BPH, okay, there's no shortcut. I will always advise everybody to go to have a medical intervention. But there are natural treatment that can include specific actions or lifestyle changes that you can make to help relieve the symptoms of BPH. Okay, so there are some lifestyle changes that you can do to relieve the symptoms. But I always advise everybody, okay, seek medical attention, speak to your doctor, speak to your family doctor if you have BPH. Now, what are those natural treatment that can help you relieve those symptoms of BPH? Is one is, we're looking at the steps you can take on your own, because you're asking of treatment without medical intervention. So in that way, you are asking me to advise you what are those steps that you can do on your own without any medical intervention to see if it's going to relieve the symptoms of BPH. And one is urinating as soon as you feel the urge. So anytime you feel the urge to urinate, go and urinate. Don't delay it. Don't hold it. That's one. And we're looking at a natural way to that can help you relieve the symptoms of BPH. Okay, you are relieving the symptoms of BPH, but you might not be treating the symptoms of BPH. There are two different things. So anytime you feel the urge to urinate, go and do so. Do not delay it, do not hold it. Now, the second one is going to the bathroom to urinate even when you don't feel the urge. Okay? So the first one is urinate as soon as you feel the urge. I feel I want to urinate, go and do it immediately, do not hold it. The second one is go to the bathroom even if when you don't have the urge to urinate. And see, maybe you might be sitting here now, you don't feel like urinating, but as soon as you step into the bathroom, you feel you have the urge. So you are encouraging to pee than holding it back. Now the next one is avoiding over-the-counter decongestants or antihistamine medications, which can make it harder for bladder to empty. So you got to be very careful. Most of these medications you buy over the counter on the chemist, you got to be very, very careful. And that is why I advise everybody, any over-the-counter medication you buy, make sure if you are taking a prescribed medications, make sure you consult your doctor before taking such medications that you bought over the counter. So some of the decongestant or antihistamine medications might interfere or make it even worse for your bladder to empty. Okay? Now, avoid alcohol or caffeine, especially in the hours after dinner. So avoid alcohol, limit the consumption of alcohol or avoid it totally. And also, do not take caffeine when you're about to go to bed. Some people develop the habit, take their caffeine 8 p.m., 9 p.m. That is wrong. Always take your coffee in the morning, first thing in the morning, so it gives you enough time for your body to process it and get rid of it from your system. But avoid taking caffeine when you're about to go to bed at night. And avoid alcohol consumption or limit the intake of alcohol consumptions, because it's going to make it harder for your bladder to empty. Now, the next one is reducing your stress level. Stress levels and nervousness can increase the frequency of urination. So anytime you feel stress, there's an urgency to urinate. So you have to reduce your stress levels. We are looking at natural way that can help you relieve the symptoms of BPH without any medical intervention. Okay, and then the next one is exercising regularly. It is important to be active. Physical active is very important. Exercise regularly. Exercise is very important. Exercise regularly. Okay, so when you exercise regularly, as lack of exercise can also aggravate your symptoms. When you exercise, when you build your body to be so active in your younger days, by the time you get age, you see some men that are 70s, 80s, they look like they are in their 50s. Because right from childhood or right from their young age, they've been exercising. So by the time they get older, their bodies still look fit, younger, and also avoid those complications that comes due to old age. Because when your muscles getting weakened, it's one thing you have to understand that when you age, your muscles are weakened. So if you are not physically active and you attain the age of 50, 60, 70, you've never exercised in there before, by that age you see that you are weak. You can't even climb the stairs. Because the more your muscles are weak, the more you get weaker and weaker and older, the more you are prone to risk of other kinds of illness. So it is good to involve exercise. Physical exercise is very important for you to live stronger in your old age. Now, learning and practicing Kegel exercise to strengthen your pelvic muscles. I'm going to discuss about pelvic muscles. Pelvic muscles is very important in terms of your sexual activities, either a man or a female. So when you exercise, when you exercise, you are strengthening the muscles in around your pelvic area. And those pelvic area is what is responsible for your sex. If you have a weak pelvic muscles, you might find it very difficult to enjoy sex or to have sex. Your pelvic floor muscles are the key to strong intimacy to enjoy sex. Okay, so learn about Kegel exercises, and also keeping warm, since being cold can make symptoms worse. Keep your body warm. Don't expose your body to cold, because that can make your symptoms very worse. We are looking at these natural ways. Now, these are to relieve. Remember the word relieve the symptoms of BPH. They do not treat the symptoms of BPH. There are different ways of relieving and treating. You have to treat the underlying cause to get rid of those symptoms. But when you relieve it, it's temporary. Okay? So that is it. Do we have more questions? Julie, I'm doing well. I'm doing well. Thanks for asking, Julie. I'm okay. I believe you are doing fine. How is your country? Good. Julie, you've been very scarce. I've not been seeing you consistently. What is going on? I hope you're okay. How is Guyana? Yeah, wandering ways. Thank you very much, ultrasound. Ultrasound. Yes, I'm referring to ultrasound. Yeah, thank you very much, ultrasound. So that is what they're going to use to find out if you are emptying your bladder. I don't know why that didn't escape my memory. Okay, so now let's me go to the last question here. If you guys, for those that are watching me on YouTube, if you go to my Facebook page, Managing Diabetics, you're going to see on my comment what all these things that I'm discussing with you. Okay, if you want to read more, you go to my Facebook page, you go to the comment sections, you see that everything I said to you, I put them on the comment section. I have some fans that are deaf, they can't hear me. I have about a couple of fans that are deaf, so they cannot hear me. So anything I say, I try to put it on the comment section so they can also follow along. So they read what everything that I said to you, I put it on the comment section. So they also read along. They can watch, but when I put it on the comment section, they'll be able to read along and understand what I'm saying. So So those that are watching on my Facebook, if you want to understand, or maybe you forgot what I just said, go to my Facebook page, Managing Diabetics. You go to the comment section there, you see everything, all the questions that I answered, whatever I said, that can help you to refresh in your memories. So I have two Facebook pages, Managing Diabetics TV and also Living with Diabetics. So I have two Facebook pages. One is Managing Diabetics TV and the other one is Living with Diabetics. So these two pages on Facebook are all mine, and then the YouTube. Okay, so if you guys want to understand what I just said, you can remember, go to my Facebook page, all right, and then you could go to the comment section under the video. You see everything that I just posted. I said I put in there, so that my fans that are deaf can also follow me along and understand what I'm saying. So let's go to the last question. Can you treat benign prostatic hyperplasia without medical? We have answered that question, but I also recommend that for my preferences, I'll ask you, it has to be with medical intervention because you're fighting for your life. Life has no duplicate. So what medication are used to treat BPH? What medications are used? BPH. Most of the time they use blockers. There's something we call blockers, okay? Alpha-1 blockers. So the question here says, what medications are used to treat benign prostatic hyperplasia? We have alpha-1 blockers, okay? Most of the time they use alpha-1 blockers. And also we have hormone reduction medications, and we also have antibiotics, okay? These are the key three major, or the three key ways they treat BPH. Antibiotics, hormone reduction medications, or alpha-1 blockers, okay, to treat BPH. Now, as I said, BPH is the same thing as prostate cancer, but when you hear that you have prostate BPH, do not panic yet. It could be benign or malignant. So when you have enlarged prostate, it could not be cancerous, just you have an enlarged prostate. So what you have to do was, so once they say, after biopsy, they say, okay, this is not cancerous. Now doctors are going to figure out a way how to shrink that enlarged prostate. So they can shrink it by doing some medication to shrink it to normal size, that you are okay to pee. But there are certain centimeter of enlargement that is not, you can't shrink it, you have to go under the knife to get rid of it. Okay, and that one is another costly issues on that. So alpha blockers might help you to shrink the prostate, okay, or we have the hormone reduction medications, and we have the antibiotics. Okay, now the alpha-1 blockers are medication that relax the muscles. So when you use alpha-1 blockers, they are type of medication that relax the muscles of the bladder and the prostate. Okay, so alpha-1 blocker relax the neck of the bladder and makes it easier for urine to flow. Example of alpha-1 blockers medication includes dulzacin. There's something we call dulzacin medication. Okay, dulzacin medications, we have prazosin. Those are some few examples of alpha-1 blockers, and we have alphosocin. Alphosocin, okay, prazosin, or we have dulzacin. Those are medications under alpha-1 blockers. Okay, we have terazosin. Okay, those are alpha-1 blockers. So what it does, it helps to relax the muscles of the bladder and the prostate. So it blocks, okay, relax the neck of the bladder. And when it relaxes the neck of the bladder, it makes it easier for the urine to flow easily. So that's why we use alpha-1 blockers. Now, when we come to the hormone reduction medications, and listen, those medications that I just listed is not a recommendation or prescriptions. It's just I give you examples of type of alpha-1 blockers. So do not go to the pharmacist or the chemist, say, please, I need alphazocin or I need prazosin. Those ones have to be given to you by your doctor. Okay? So now, what is hormone reduction medication? So the hormone, by its name, it reduces the level of hormone that hormone produced by the prostate gland. Sometimes your prostate gland produce too much hormone that causes it to enlarge. So when you use this hormone reduction medication method, it reduces the level of hormone that is produced by the prostate gland, such as dutasteride. Dutasteride is one of the hormone produced, or we have the finasteride. Finasteride, those two hormones are produced by your prostate glands. Okay, so those two medications can be given to you or prescribed by your doctor, okay, to help to reduce the number or the quantity of hormone produced by your prostate gland. Sometimes it's happen like those that have a thyroid issue. We have the hyperthyroidism and we have the hypothyroidism, underreactive thyroid or overreactive thyroid. Sometimes your thyroid produces too much hormone, sometimes it produces less hormone, sometimes it gives you a problem. I have been unlucky to remove one of my thyroid gland because my own is overreactive thyroidism. So if your prostate gland is producing too much hormone, that can be a possible cause. So they're going to use this hormone reduction. So they're going to prescribe you dutasteride, or we are going to probably finasteride. So finasteride, these are medications that can help to reduce the number of hormones produced by prostate gland, thereby not causing you to enlarge. So sometimes your body might malfunctions, and then they're saying your prostate glands are producing too much hormone. And the thyroid gland can produce overreactive or underreactive, and it causes you a problem. Okay? So then we have the antibiotics. Okay? We have the antibiotics. Okay? When the prostate gets enlarged, it becomes inflamed from bacteria prostatitis. Okay? So when it's inflamed by bacteria, then we have to use antibiotics to treat it. So these are just few ways to treat BPH. Okay? And then, as I said, your doctor is going to determine to you when to see it. Your doctor is going to determine when for you to go under surgery, under a knife to remove it. As I said, everything go by centimeter. There are certain centimeter is going to reach, then you have to go under the knife. And there are certain centimeter, they keep it that way and they shrink it. All right, friends. Okay, so that I'm going to stop here for today, and then follow me onwards. Go to my page. Okay, I'm going to be, when I go offline, I'll spend some time on the page answering some questions that come into my mailbox. So I'll be there watching out for all your comments and your messages. If anyone comes, I'm going to answer it. So I'm going to stop here today to say thank you for those that are watching me on Facebook, YouTube, Cool Swag, and who again, and Wandering Weeks. Thank you for reminding me it's ultrasound. Okay, so follow the page. If this is your first time coming across my page, please subscribe to my page on YouTube and on Facebook. It's free to subscribe. So anytime I download a new content, you'll be notified, or when I go live, you'll be notified. And also share the page and share the video to your friends. In this community, we discuss about diabetes and complications and other chronic conditions. So if you have any issue regarding your health issues, diabetes, high blood pressure, cholesterol, this prostate issue, ask your questions. I'll be able to help you guys. All right? So we are here to help each other discuss the issues and how to treat diabetes and how to live with it. Okay? So, friends, thank you for watching today. And hopefully I'm going to see you guys shortly. Tomorrow, again, I'm going to hold another session tomorrow live. At the same time, I'm going to be doing another live video on a different topic. So as soon as I finish this program, I'm going to post the title of the discussion we're going to have tomorrow so that you guys be aware and be ready to join the program. So keep watching, and I'm going to see you guys soonest. Thank you guys very much, and then give this video a thumbs up if you like it. Hopefully to see you guys again, and say what, enjoy your Saturday afternoon or evening or morning depending on your locations. Hopefully to see you guys soonest. Bye bye.